Assalamualaikum and have a good day. My name is Muhammad Izwan Shah bin Manasih, and today I'm gonna talk to you about the how to deal with depression. Student, if I may ask what is happiness mean to you, can you think about something that can make you feel happy living? It could be that you are happy hanging around with your friends until late night by doing assignment together or even going on a road trip together. But can you imagine what if one day you could not feel the happiness in you again? The world you live suddenly seems dark and you feel hopeless, dark thoughts self-loading, feeling overwhelmed that you are fine where you are not fine. The feeling that even you yourself could not describe the worst point in your head overpower you by pulling everyone and everything away and puts in a dark place and say, this is where it's supposed to belong. Believe or not, there are a lot of people out there currently feeling like this every day in their life. Ladies and gentlemen, our topic for today, which is how to deal with depression, and currently this topic is very famous in our era today. I have done some researches on the article and the news about mental illness, especially about depression. Moreover, I have also watched video from the patient that suffer from this illness and the challenges that she experienced in her daily life. Many of us did not take mental illness as a serious matter and could not even say a joke about it. I am being more aware about the choice of my word and action that could be possible hurt and trigger people with depression. According to the John London psychologist specialized in treating anxiety and depression, depression often robs you a memory of happiness, joys that it could be difficult to draw on happy memory that could find one hope for the future. The World Health Organization (WHO) estimates that 265 million people around the world have suffered from depression. According to the Malaysian Today, in 2017, the National Health and Morbidity Survey found that 29% of Malaysians are suffer from depression and anxiety disorder compared in 2011 with 12%. Depression is a psychiatric disorder that is harder to recognize than medical disorders such as a high cholesterol and some other illness. According to the World Health Organization, depression is the condition that is driving to a cause of disability globally and significant contributor to a global illness. In 2018, the patron of Malaysia Psychiatrists Association, a person who named Lilam Chai, said that depression will be a major illness among Malaysians in 2020. For example, according to the graph, Malaysia is ranked 6th among 9 countries in the prevalence of depression among university students with 27.5% in 2013. There are some factors that contribute to the depression. First, due to the academic stress among the students, such as in academic performance, examination, assignment, and another continuous assessment. Next, let me take you to the next point. Refer to this pie chart show that the most of the students are depressed because of their studies and academic achievement, with 46.5%, and the second and the third highest fall to the relationship, and the other matters with 23% and 12.3%, and the lowest factor is personal health with 1.8%. Based on the above chart, Malaysia is among of the country with the highest prevalence of depression among university students, and the highest sector that contributes to depression among students is because of their study and academic performance. Not only among students, today we can see a lot of people out there who facing the depression, for example among teenagers, employer and parents. Let's look more deeply. Depression among teenagers. The cause is neurotransmitter. Neurotransmitters are usually occurring brain chemicals are abnormal or impair the function of nerve reception and nerve system changes leading to depression. Besides, hormones also influence the people to get depression. Something that we can look the body changes in the body balance of hormones may be involved in causing or triggering depression. Next, employer. We can see depression will occur for employees related to the toxic work environment, being overworked, no work-life balance, lack of flexible work, being underpaid, working irregular hours, and being bullied or harassed. Sometimes employees won't even know they are being affected by work adversely. For example, working long hours constantly or working irregular shifts can also suffer from depression. Hence, among the parents, we can see our parents will become stressful. We know parenting can be very stressful experience, especially for new parents. The demands of caring for a child combined with the lack of sleep and other challenges can take a toll on parents' mental health. Next, medical problem. Parents who have chronic medical condition or who have children with medical problem are more likely to experience depression. The stress of managing a medical condition can be overwhelming and it can be difficult to care for a child while also dealing with your own health problem. Moreover, parents also will face depression due to the financial issues. Sometimes our parents give problem financial to support and survive their family so that they will feel depressed and due to stress in thinking about that. So, ladies and gentlemen, there are some effective ways on how to deal with depression that everyone in the world can take to minimize depression. First thing first, you can meet yourself where you are. Depression actually affects millions of people, including some in your life, and you may not realize they face similar challenges, emotions, and obstacles. Next, you can consider a walk around the block in day when you feel you can get out of bed. Exercise may seem like the last thing you want to do, but exercise and physical activity also can help reduce symptoms and depression and improve energy levels. So research suggests that for some people, exercise can be as effective as medication at relieving depression symptoms. It may also help prevent future depressive episodes. Even when you feel you are unable to or have little energy, see if you're willing to do the opposite of what your mood tells you to do. Instead, set a small goal for yourself, such as walking around the block. Besides, you can do something you enjoy. As you know, depression can push you to give in into your fatigue. It may feel more powerful than preferred emotions, so you can try to push back and do something you love. Something that pleasurable or meaningful. It could be playing an instrument, painting, hiking, biking. In fact, engaging in meaningful activities lift your mood or energy, which can further motivate you to continue to engage in activity that help with navigating symptoms. Next, you also can listen to music. Some research has shown music can improve your mood and symptoms of depression, and it may also strengthen your reception of positive emotion. Music can be especially beneficial when performed in group settings such as musical ensemble or band. You can also reap some of the same rewards simple by listening. In addition, another way to deal with depression is you can spend time in nature. Time in nature can have powerful influence on a person's mood. Research suggests that walk in nature may improve depressive symptoms in people with clinical depression. Time in nature space may improve mood and cognition to lower the risk of mental health disorder, but there's only limited research on the direct effect of nature on those with clinical depression. One more thing, the effective way to deal with depression is you can take antidepressant medication. Means you can make any appointment with any doctor and ask permission from doctor to take antidepressant. Medicine is prescribed according to each individual symptom, so there is no one-size-fits-all type medication. Then another, with most of this medication, improvement is not immediate. It takes 1 to 3 weeks before changes occur. Last but not least, we can get more sleep. Sleep and mood go hand in hand. Get to the title of the former and latter about bounds to be affected whether you have depression or not. To support your emotional well-being, you need to make sure you have depression or not. Make sure you have what sleep experts call and good sleep hygiene. This means you keep constantly bedtime and wake up time. You have a relaxing bedtime routine that doesn't involve sitting in front of a screen, and so on. When you get enough sleep, your body can still feel refreshing, and you will be more cheerful. Before I conclude, I would like to ask you guys, did you have any feeling or something that can bring you near to the depression symptom? If you have that kind of symptom, you need to deal with it quickly before it gets worse. In conclusion, depression could affect anyone despite of their age, gender, title. So I suggest people that are diagnosed with depression and should seek help from professional or school counselor, and also you can follow and practice the method I have discussed earlier. Don't give up on yourself and keep fighting the voice in your head. I know you can win. That's all from me. Thank you.